Here's the journey from your first visit to your final smile. First, we take records and we do a 3D scan of your face so you can see you in 3D, which is kind of unusual if you haven't seen that before. We design the teeth to fit your face, and from that, you give us the go-ahead, and we schedule the surgery with the anesthesiologist, who is going to be sure you're comfortable for the entire visit. They zonk you, you go to sleep, we do the surgery, and you wake up with these permanent teeth that are the ones you chose ahead of time. And you get to test drive those for 3 months while the biology occurs, while your body heals to those dental implants. Sometimes we go 4 months, and at that point, when you say perfect, don't change a thing. In other words, we fine-tune some of those details and you have a bridge that you're thrilled with. Then we go to the zirconia version, the exact same version of that bridge that you've been wearing, but made out of a different material. From that, we deliver that, so 6 months from our start date, you have a zirconia bridge that feels like teeth, that functions like teeth, that you do not have to worry about, and it's a total transformation from where most of our patients start from.